Let's take a look at the news from around the world to the United Kingdom first, where the NHS report has said that the Indian diaspora is among the worst affected minority groups. Those of Indian ethnicity account for 3% of the overall death figures. Joining me now is Dr Chaand Nagpaul, Chair of the British Medical Association Council. Sir, thanks very much for joining us. You've spoken about this earlier as well, sir. What's the reason behind this and how big a concern this is among the Indian community there?
Well, this is a real concern for us because 35% of all of our intensive care beds are occupied by people from Black and Asian ethnic minority backgrounds, and the largest proportion of that are Indians. And we also have a disproportionate impact on healthcare workers. Out of the first 17 doctors who have tragically died, 16 of them have been from the South Asian continent or from Afro-Caribbean backgrounds. So 16 out of 17 have been ethnic minorities. So this is really worrying for us as a profession, for our community. I called for an investigation to government to look into this because these figures are stark. They don't have any clear explanation, and we now are going to have a formal review and investigation and research. We don't know the reasons why. It's a new virus, but some of the possible reasons are that the Asian community, as you know, has higher incidence of diabetes, heart disease, and high blood pressure, and those themselves are factors that can make the illness much more severe. But there may be other factors. We know that we live as Asians in multi-generational extended families in one household, and whether that has a part to play in increasing spread of the infection. But also remember that if you spread that infection, the older members of the household are the most vulnerable because this disease, COVID-19, affects older people more than it does younger people. We also have the largest, Asians play a very large part in the key essential roles of the UK. There are higher numbers of Asians who are in shops, keeping shops open for vital supplies, working in transport, delivery, taxi drivers, and so forth. And so it may be that they are more exposed to the virus. And of course, there are going to be other reasons we don't understand. So we're asking for this inquiry and research to understand why this phenomenon is occurring.
All right, Dr. Nagpaul, stay safe there. Thanks very much for joining us.